Come in.
Good morning, Mrs. Smith. How you doing today?
I'm good. How are you?
I'm fine, thanks for asking. My name is Tricia. I'm going to be your CNA today, and I'm here to clean your bottom and private area. Is that all right?
Yes.
All right, I'm going to provide privacy, wash my hands, get my supplies, and I will be right back. So we don't have a curtain in this room, so I'm going to pull my pretend curtain. I'm going to wash my hand, and I'm going to get my supplies. So I'm going to grab a towel for underneath, because this is a water skill. Okay. And I'm going to just pull this over so it's ready to use. I'm going to get soap in my bucket, and it's kind of out of order because the supplies are out of order where we are, but it works the same way. I'm going to get 7 washcloths. 1, 2, 3, 4, 5, 6, 7. I always take 7 for a water skill that's washing part of the body. We only use 6, but 7, that you have 7 just in case you drop one and you don't have to worry about going to find another washcloth. All right, so I got my 7 washcloths, and I have 2 chucks. 2 chucks. Okay, there we go. And a pair of gloves. So I got my gloves. All right, first thing I'm going to do is I'm going to go get some water. I'm not going to touch the switch with my arm. I'm going to use that arm. I'll use a towel to turn on the water, and I want it to get nice and warm. It's going to take a minute. I see the hot water is finally coming, so let me get some more warmer water. Okay, we're going to take this in the other room. I don't need much, you can see. And I'm going to go over and I'll ask the patient to check the water. Mrs. Smith, can you please check the water for me? When I say that to the resident, the evaluator will also check the water at the same time. All right, we are all set, Mrs. Smith. All ready to rock and roll here. Got an extra soap. All right, my friend. Get these on. And then what I need to do is I need to have you come towards me a little bit. And I'm going to have you roll on your side, excuse me, so that I can change your chucks underneath you, okay? 1, 2, 3, over you go. I'm using my hand like this to get underneath the chucks and flip it all the way over without touching the white part, because the white part is the dirty part. And I get that all the way under, tucked under. I'm gonna grab a clean chucks. This and this, and tuck that from about right there. Done. Tuck that all the way under and roll her back, okay? Now I should be able to get the dirty chucks out without going to the other side. So I'm gonna reach under and make sure I don't touch the white. I'm gonna move that and just get that out of my way. I'm putting in a dirty pile right there. And I'm gonna grab this. All right, Mrs. Smith, I'm going to put you in the center of the bed for your safety. All right. So I'm going to just expose you for a minute. I'm only exposing the area I need to work on. So I'm going to put 4 washcloths in here. Wring it out a lot. You don't need a lot of water. And I'm going to put a tiny, tiny bit of soap. Okay. moving around. Now I'm gonna taco my washcloth so that I can peel each layer off. I have to hold the labia apart, and I'm gonna go inside, turn, inside, turn, outside, turn, and outside all the way down, turn. Now I'm gonna rinse. Okay. Again, inside, turn, inside, turn, outside, turn, and outside, turn. Going all the way from the groin all the way down the back. Now I'm going to dry. I'm going to use a dry washcloth because the area in there is really tiny. So it's hard to get a towel on that spot. So I'm going to taco my washcloth, and I'm going to hold the labia, and I'm going down gently by patting. So one, turn, one inside, two inside, turn, pat, 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 and turn. And I'm just going to grab that water right there and then pat all the way down. All right, Mrs. Smith. The front of you is all done. I'm going to roll you over onto your back so that I can do your bottom, okay? So I'm going to have you come towards me again, and I'm going to roll you over onto your bottom. There. Getting a tiny bit of soap. All right, and I don't know if the evaluator is going to support her as you do this, so I'm going to support her just in case the evaluator doesn't. I don't need to taco as much. I can use different sides, but I still need to change the spots on the washcloth. So I'm going to start with her top cheek nice and wide and go straight up. I'm going to turn and give myself a nice big wide spot, and I'm going to start at the bottom cheek and go up. Now I'm going to do the center, touching the anus, making sure they see me wash that, come up, and I'm going to do it one more time. Okay. I'm going to rinse, doing the same exact movements I just did. So it's going to go top, bottom, middle, middle. So top, bottom, middle, and middle. All right, Mrs. Smith, I'm just going to dry you now, okay? Pat, 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 pat. Pat, 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 pat. Pat, 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 and we'll just do it a second time to make sure it's dry. Now, what I have to do with her, that's my dirty one, this is my clean one. I now have to change it again because it's probably wet, and what it's done is protected the mattress. So I'm going underneath again without touching and flipping that over as far as I can. And I'm going to squish it all the way under as far as I can. Getting my clean chucks. And I'll let that down that way and just kind of roll it up. And again, I'm going to kind of tuck underneath that other pad. Get this over as far as I can. Tell me to hold that just a little bit to do this correctly. There we go. That's the
Careful.
best I'm going to do. All right, Mrs. Smith, I'm going to roll you back, okay, support you and bring you back. Let's get your legs uncrossed. Okay, and I'm just going to grab that dirty chucks out from underneath. So I've got that. I'm going to put that there for right now. I'll roll this out. Let's keep you covered. And I'm going to center you on the center of the bed for your safety. All right, I'm going to pull up your sheet so you stay a little bit warm. Not too bad today, it's pretty nice. There we go. All right. All right, so now the first thing I'm going to do is I'm just going to take my soap and put it there. I'm going to put these in a trash barrel, which is not there, but I'm going to pretend there's a barrel there and move this around. and I'm going to take this to be cleaned. I'm going to turn on the water with a paper towel. I'm going to lift up the toilet seat and I'm going to dump that water and get rid of that paper towel. Get a tiny bit more water, swirl, empty. Turn off my water, put down my toilet seat, and flush. So now I'm going to dry the inside. I start with the bottom, work my way all the way up to the top, and go all the way around so it's nice and dry. Grab one to hold and one in my hand. And I'm going to head right back over here. And again, there's no trash barrels. I'm going to pretend there is that. I'm going to pretend there is actually a trash barrel here. I'm going to use this. So I'm going to remove my gloves, not touching my skin to the outside of the glove. And I'm doing it like this and like that. Okay. All right, my hands are clean. Oh, I'm going to tell the evaluator I forgot to put away the soap, but my hands are clean so I can do that. So I'm going to put my soap in, and that's a hand sanitizer. And now I'm going to hand my patient, my resident, her call bell. Here's your call bell, Mrs. Smith. Are you comfortable?
Yes.
Is there anything else I can do for you while I'm here?
No, thank you.
Would you like me to turn on the television before I leave?
No, thank you.
If there's anything else you need, you call me and I'll come back, okay?
Okay.
Use your call bell. Have a great day.
You as well.
All right. So I got that. I'm opening my curtain before I take away my dirty linen. I do that, make it in a nice little package, drop it in the dirty linen. I'm washing my hands. I'm going to check my skill that has been given to me. I'm going to read it to make sure I did everything. Now, if I have done this and I've raised the resident's bed to do this before I walk out of the room after I've done the call bell would be when I would lower the bed. I did not do that because I didn't raise it. It was just in the position it should be. All right, I've read that. She has a call bell. The curtain is open. I'm washing my hands. My skill is complete.